Good morning, everyone. My name is Crystal. My name is Crystal Schaldemose, and together with Teresa Comodini Cacchia, I'm chairing this working group in the European Parliament's working group on diabetes. Welcome here, and we have together a whole hour, but we also have a very long agenda, so I think that we should begin more or less on time. I think that, first of all, I would say that the purpose of today's meeting is a kind of a relaunch of our working group and also to have a debate on the state of play on diabetes in Europe. What should be the key priorities for the European institutions when it comes to diabetes and chronic diseases? We're not starting all over. We're building upon what we already have achieved in the last years. And that is, of course, a lot. In fact, we should be happy for that, but we also need to move on to work even further on how to tackle chronic diseases and diabetes in particular. So I hope that today's meeting will give us a new focus and maybe even some promises from the Commission. Let's see. But anyway, welcome everyone. I'm going to chair us through this meeting, but I will try not to speak too much because I think it's more important to listen to people knowing something about the topic. I think that we have a long list of good speakers, but we also have some time for discussion. So I hope that you will all participate in that once we are coming to that point in hopefully 40 minutes. But I welcome all of you here today, and now I will give the floor to my co-host, Teresa, who will say some words as well, and thereafter we will go directly to presentations from the chairman of the European Coalition for Diabetes, Chris de la Carta. But welcome, Teresa, and the floor is yours.
Thank you, Christel. I'd also like to join Christel to welcoming you for this debate, for this exchange of views this morning. I have to say, I have been going through some information on diabetes, and this information keeps on, thanks to our NGOs, this information keeps on being built upon. And I found the numbers very disconcerting. The numbers of persons who face diabetes, who live with diabetes, is always growing, is always on the increase. And this is very disconcerting to me as an MEP, but it's also very disconcerting to me because I am an MEP from Malta, a country where the number of people living with diabetes is extremely high. But I've decided to continue in the footsteps of Simon Busuttil, who was previously MEP working in this working group, mainly because I can see the challenges, the everyday challenges that people back home facing and living with diabetes actually have to face in their everyday life. And if you look at the figures, and this is something I usually never exchange persons for numbers, but in this case, I cannot but note that 56.3 million adults live with diabetes in the wider European region, and that in 2035 it is estimated that about 10% of the total population will be living with diabetes. And this disease, from what I see with living with persons who do have diabetes, this disease affects the person's life in a way that it affects his or her interaction within the community, within society, as well as his or her contribution to that society. So it is a disease that affects one's quality of life, besides also placing a huge financial burden on the healthcare systems, on public healthcare systems. And to me, this makes it evident that the EU institutions, along with EU member states, need to be key players in coming up with action to prevent and tackle this disease. But we also need to work together on various fronts. I do not want to take too much time because this is merely an introduction, but I will drop a few thoughts just to help you prepare also for your input towards the exchange of views later on. What about awareness? What about really showing our appreciation to NGOs who have, over the last years, been working very hard to create and raise awareness of the challenges that people with diabetes face in their everyday life? And what about actually trying to take better coherent action within the EU and between member states to support those NGOs better? How about research and more investment? Research has played an important role in the advancement of prevention and addressing diabetes. And yes, the EU has taken a number of initiatives to fund research. However, much more is needed. What about prevention and treatment? What is happening to prevention progress plans within our member states? How about data collection? How are we monitoring those prevention plans and also those treatment plans that we are offering? And what about education? And in relation to education, do allow me to raise one specific issue, which I have encountered through a family with a child who has diabetes. And I have seen children who have diabetes whose access to education is really hindered, especially in those schools which do not offer a comfort or a system of safety and security for that child who might need treatment during school hours, and a school that does not have a system for that child to have that treatment during school hours. And I believe these are all issues and challenges that persons with diabetes have to live with. But we also here have a responsibility at European level to try and make their quality of life better. So I think I'd stop here, and I'd love to listen to the exchange of views and to what you have to say also at a later stage.
Thank you so much, Teresa, for setting the state of play in a good manner. We have a challenge, and we need to do something about it, and especially for the many millions of European citizens with diabetes, but also from a financial point of view, it is important that we take actions. But the next speaker is already waiting. So Chris De La Carta, you're the chairman of the European Coalition for Diabetes, and I'm really looking forward to hear your presentation. Welcome, and the floor is yours.
Thank you, dear MEPs, and thank you for the support you give the diabetes community in Europe. The purpose of my intervention this morning is to speak about the European Coalition for Diabetes and the EU Diabetes Working Group, and what these two organizations, the organization and the working group, what they stand for. Going back to history, in 2009, 4 organizations, the Alliance for European Diabetes Research, EURADIA, the Foundation for European Nurses in Diabetes, Primary Care Diabetes Europe and IDF Europe, joined forces and made a significant stride forward in their efforts to coordinate their EU policy action. Subsequently, the European Coalition for Diabetes was formed, and the coalition brings together expertise in research, diabetes nursing, patient organizations, and primary care in diabetes. We argued, we debated that collectively we have a stronger diabetes voice in Europe. We all have a common goal, and we feel that we could improve the lives of persons living with diabetes in Europe. The objective of the European Coalition for Diabetes is to improve prevention of diabetes, as well as health and quality of life of European citizens living with diabetes, by primarily influencing EU policy. We have in the past encouraged upcoming presidencies of the EU to feature diabetes on the health agenda, resulting in a stronger statement to the European Commission. This was done in the past with the Hungarian presidencies, Polish and Denmark. We encouraged the EU Health Commissioner to address diabetes during his mandate and ultimately to develop a diabetes strategy. And it is also significant that we have the representation of the EU Commission here with us this morning. Likewise, we also encourage the EU Research Commissioner to include diabetes as a major focus area. We leverage the support of the European Parliament to influence the other EU institutions through the platform of the EU Diabetes Working Group. We use this working group as the key driver for change. This working group is a group of cross-party, cross-national MEPs with particular interest in diabetes. Going back to history, this was first created in November 2002 by John Bowis, who was a serving MEP, Mary Benotti, and IDF Europe with the support of the then EU Health Commissioner David Bryan. It was relaunched with success in November 2009 to act as a strong platform to build the European Coalition Diabetes EU Public Affairs Programme. It included 4 MEPs who spearheaded the work during the last legislature: Simon Busuttil from Malta, Sarah Latford from the UK, Christel Skeldemos from Denmark, and Marisa Matthias from Portugal. The co-chairs are strongly committed to the diabetes cause. They represent in the European Parliament the best interests of all people with diabetes in Europe and provide dedicated support and advice to the diabetes community in driving policy change. One significant achievement of the work of the EU Diabetes Working Group was in March 2012, where after years of committed advocacy work by the European Coalition for Diabetes and the EU Diabetes Working Group, we achieved on the 14th of March 2012, by a large majority, a resolution addressing the EU diabetes epidemic. It called primarily on the Commission and Member States to develop and implement a targeted EU diabetes strategy in the form of an EU Council recommendation on diabetes prevention, diagnosis, management, education and research. So what is the mission of the EU Diabetes Working Group? It's to raise awareness, to stress the need for urgent action, to ensure diabetes is prioritized on the EU health agenda, to map out concrete actions for change, to obtain the support of other MEPs for diabetes-related initiatives, and to maintain regular contact with MEPs and provide them with up-to-date and accurate information. And if I have to sum up the objectives of the EU Diabetes Working Group, I could classify these in 5. Public health, to gain recognition of diabetes as an EU public health priority and support cross-sectoral policies, legislation that promote awareness, prevention, diagnosis and management of diabetes. Research, to secure increased funding and better coordination in all fields of diabetes research in Europe. Consumer protection, to ensure that consumers, those are people living with diabetes, have clear and easily understandable information on the content and nutritional value of the food they buy. Employment and social affairs, to support EU policies and legislation that prevent the discrimination of people with diabetes in all aspects of their life, including education, recreation and employment. And patient rights and safety, where we put patients, including those living with diabetes, at the centre of EU healthcare policies and legislation and ensure that the rights and safety are protected. These working groups have existed both on a national level and also on a global level, to mention IDF's programme, the Global Parliamentarians for Diabetes Champions. These all-party working groups prove, without any doubt, that diabetes has no political colours, and whenever there is a health issue that concerns a good part of our population, members of Parliament could adopt a bipartisan approach to work in the interests of such persons. Diabetes affects us all. We all have members of our families and friends, distant or close, who have this condition. It is a chronic condition that could lead to unpleasant complications such as cardiovascular problems, renal problems, nerve damage, blindness. So the parliamentarians play an important role in all this. We NGOs could work with you, we could highlight the issues, however you have the power to legislate and make things happen. The EU plays an important role to develop an EU strategy that will be mirrored in each of our member states. Diabetes affects us all. It is not only a global or national issue, but it is also a European one. This working group has always been active and an effective voice for diabetes in this Parliament. And I have no doubt that this work may be pursued in the interests of the millions living with diabetes in Europe. The current setup of the EU Diabetes Working Group, we have 3 co-chairs, Christus Geldemos from Denmark, Therese Comodini Kakia from Malta, and Marisa Matias from Portugal. It is good that we have representation from various political parties in this parliament, and with the 2 leading parties also represented, but we would like to have more members of parliament from the European Parliament with us here, so that we could effectively have a stronger voice in our work. I look forward to having a constructive discussion this morning, and I hope that I'm ahead of time. So.
Thank you so much, Chris. Yes, you are ahead of time, but that's splendid. The points were clear, and it will leave us more time for discussion later on. Then I'm going to give the floor to the next speaker. It is Anne-Marie Felton, President of the Foundation of European Nurses in Diabetes. And for all of us who has been working with diabetes for years, we have met Anne in so many different occasions, and always with a clear voice, talking in favor of patients with diabetes. So, Anne, the floor is yours, and welcome very much here.
Good morning, everybody, and a very special thank you to you for all your help throughout the years, and to also Teresa joining us. It's a great pleasure to be here. And I also want to extend to the Commissioner for DG Santé we regret the circumstances that prevent him from being here, and we send him our very best wishes. And we are delighted, of course, that the chef de cabinet is here, because this message that we transmit to you is central through the whole team to the Commission. Very important points have already been addressed in both your opening address, your joint opening address, and also. I'm going to be unusually fast, I think. Oh, I'm doing something wrong here. If I could have the next slide, Sarah, please. So, I'm addressing really the policy puzzle, the 4th edition, and this is a collaboration between Euradia, FEND, IDF Europe and Primary Care Diabetes Europe. So those are the central pillars within the diabetes community across the whole of Europe. And I acknowledge the steering committee, and particularly Maya, who is here, we appointed him as our researcher, and the staff of IDF Europe, who have been just enormously helpful throughout all of this. I also would like to acknowledge, because you may not have met, the CEO of IDF, Dr. Petra Wilson. It's a great pleasure to see you here. So if I can have the next slide, please. I suspect that you're already familiar with what was reported on the 14th of November 2014, which is World Diabetes Day, and hence so many of you are wearing the blue circle. You've already heard in terms of the epidemiology and the prevalence of diabetes and what it means to us here in Europe. For years we have been saying that this is an urgent problem. It is ultra urgent or uber urgent now. And we do require action. We've had very significant achievements both from the St. Vincent Declaration right on to the UN resolution on diabetes. But engaging our nation states in action is one of the greatest challenges we have. And I think in terms of public awareness, and Crystal, you've already raised this already, I think that there is real public awareness within the community of people with diabetes. Where the public awareness is less effective is those who are at risk. But also we have to manage daily, from a professional point of view, people with diabetes. And one of the most significant things that has happened, I believe, in the last few weeks is that the World Health Organization now recognizes, in addition, and this is absolutely official, in addition to the primary prevention of diabetes, that they have to refocus on those who have diabetes today and how they live with it and the prevention of their complications. So there is a refocusing. It is not an abandonment of primary care prevention in the chronic diseases, but actually the management of diabetes for those who have diabetes now. So it is most fortuitous, in my view, that we are here and can realign this and engage with the World Health Organization and the other significant organizations. So I'll move on, but that is an important positive message to get across here today. The next slide is, I can't see it, I hope you can, but fortunately I have my paper cut out, otherwise I'm completely lost. So this audit actually took place in 2014 and was published, as I say, in November 2014. It was intense work, and like Mayor, who led this primarily from the research point of view, many, many thanks for your endless hours. And it actually, there is some good news, but it is infinitesimal. In terms of national diabetes plans, there has been a distortion in a way. I think because of the public commitment or the global commitment, the primary prevention of chronic diseases, national governments in Europe have slightly drifted from the national plans for diabetes. And so we have not seen the significant number that should have emerged following the previous edition. So we have to refocus both at a national level and at a pan-European level. And I think that the EXPAND group, which is being established, led by Adrian Saunders, who is an MP and may be an MP after Thursday. We don't know what's going to happen in the UK, but I won't bring our politics into this. Who are really engaging with national MPs so that they keep it on the agenda and then make the connections with MEPs. This is about continuity and positive engagement. So we have a challenge in re-engaging national governments to re-establish or to continue the national plans, to report on those, to monitor them, and to set out a plan of action depending on the outcomes of monitoring. Clinical outcomes are not well managed, and we can see this, the next slide please, in relation to the policy puzzle. And we also know, I mean, in terms of diabetes and pregnancy, the outcomes there are actually really poor in most of Europe, with the exception of Sweden. Sweden probably leads in this. And again, it is depressing to see that this is not adequately monitored, and gestational diabetes even less so. And the most recent reports in the New England Journal of Medicine, which is really looking at the environment of the developing fetus, if we don't get that environment in utero healthy almost from the time of conception, then there is setting down a landmark for diabetes for those offspring in the future. This is incontrovertible now. So we really have no option but to address this. So again, I have, if we can go on to the next slide, please, in terms of the key findings. So guidelines, yes, are present in many countries, and they are often an adoption of ADA or EASD and IDF and so on, but they're not being adequately utilised. Sometimes they're gathering dust. I have mentioned pregnancy. Eye screening, the services are available in most countries. However, the issue of access, of people accessing it, is less than comforting in terms of outcomes again. So accessibility, affordability, and this has implications for those people with diabetes, and increasingly for young children who have diabetes for some time. They do need to be screened. Mention was made of the provision or lack of provision for children with diabetes in schools and perhaps in secondary schools and university. We have to re-engage. And school programmes, the duty of care of teachers and those who provide care in the context of education must also ensure that children with diabetes and adolescents are not disempowered. We use this word empowerment as if it is some fashionable thing. It has very serious implications for all of us. Now, I've mentioned the national plans. In many of the national plans, it is unbelievable from what we have found that most national plans do not have a budget, or they don't know what their budget is. Now, how on earth can you plan have a national plan for diabetes and not know what is being invested and what is the return on investment. So there is such an opportunity for MEPs to engage with MPs. I realise there are sensitivities, of course, in relation to health and the nation state, but there are no sensitivities, I'm sure, with regard to cooperation. And diabetes does not recognise political barriers. So the way forward for us, and particularly with our MEPs and our really inspiring co-chairs, is to set the agenda and to positively engage, and above all for DG Sanko to engage with us. I think the time has come for genuine partnership here with WHO, with IDF, which is the voice of people with diabetes across the world, the region, and, of course, the institutions that we represent from IDF Europe, FEND, and, of course, from Euradia. And I would, if I may, and I don't wish to embarrass you, Michael, in any way, I would never do that, but it is important that we hear the voice of research here. And, Michael, if I could ask you, please, do come and join me. You can't resist it. To make a real comment with regard to research and Europe, please.
Only very brief.
Yeah.
Thanks, and I'm not really on the agenda, so I try to be absolutely brief. And I realize we academics, and I, coming from Euradia, represent the broader researching community engaged in the diabetes space. We are always perceived as a bit weird, going after easy project money for our hobbies, but the world is way more complicated, and the issues that Anne raised all require accompanying research, proper handling of data, planning, prevention strategies according to the modern standards of research, into epidemiology, into sociology. Even urban development can be led by researchers to make modern metabolic disease less likely. So we really have many unanswered questions. What's the optimal treatment for type 2 diabetes? How do we design prevention strategies? Who to address? What are the risk factors? What are the at-risk populations? This reaches into the obesity world in space. This touches upon fetal programming. How do pregnant mothers confer risk for later life diabetes to their children? Nutritional science is a big, completely unresolved arena in the world of diabetes. There is an ongoing struggle, a strive for finding a vaccination for type 1 diabetes. This is possible. We know the risk factors. We don't need to vaccinate entire populations, but small segments where we know they are at greater risk through their family pedigree, some biomarkers, but we don't have a vaccine yet. There is a constant need to invest into developing better technologies. A non-invasive measurement of blood glucose is an ultimate aim for any patient with diabetes. If you've ever pricked your finger to measure blood glucose, you'd know what I'm talking about. This is one of the obstacles to optimal glycemic control. And towards the end, I'd like to say that diabetes is always struggling from being special from a number of aspects. It's a disease, well, two diseases, type 1 and type 2, but it's also an entire disease space affecting kidney, pregnancy, eye, heart, mental, even cancer is more likely in a diabetic. So it's all over the place. It's interlaced in many disciplines, in many fields of medicine, in many auxiliary aspects of medical care. And thirdly, it's as chronic as a disease can possibly be. So it needs constant awareness, constant programs to deal with it, and constant efforts to improve the tools we as physicians and as researching clinician scientists, so to say, have in our hands. Thanks very much.
Thank you, Michael. I am about to wrap up and not delay you any further. So, from a diabetes specialist nursing point of view, I think it is important to recognise that we are clinicians and researchers, and we are contributors to national and international policy development. That's one thing. But what is really essential for the person with the diabetes and his or her family and so on is that every person with diabetes has a clear pathway of care designed in conjunction with them, with the clinician physician and with the diabetes specialist nurse. So every person with diabetes needs and requires, and it happens in some countries, a named physician and diabetes specialist nurse, because diabetes is 24 hours, 7 days a week, 365 or 366 days of the year. Thank you for your precious attention and for your engagement.
Thank you, Anne and Michael. I think that in order to have some time for a discussion which I find important, I will move on very quickly. So the next speaker, and I'm really happy to welcome you here today, Head of Cabinet of our Health Minister, Mr. Vintunas. I'm really happy to see you here, and I'm looking forward to your presentation. I just want to state one thing. We know that, and we are not challenging the fact that it is the member states who have the responsibility in health, but we believe that we could do even better by organizing and coordinating the effects and the things we're doing, the actions we're taking at the European level. And I believe that this Commission, they've said that they want to be bigger on big things. Diabetes is a big thing for many patients, millions of patients. So I think we should act not by lawmaking, but by soft measures. But still, we need EU action. So I hope that you will address that when you're speaking to us. Welcome so much, and the floor is yours.
Thank you very much. It's a pleasure to be to be here. Honourable members of Parliament, ladies and gentlemen, first let me apologize for the absence of Commissioner Andriukaitis, who really would have liked very much to be part of this discussion on managing diabetes. And thanks for nice words of best wishes to him. He's going to be back soon in the office, and happy to meet you. I'm grateful for the opportunity to speak on his behalf and to reaffirm his commitment to play the part in addressing diabetes and other major chronic diseases across Europe. Indeed, as you know, preventing and managing chronic diseases ranks highly among the Commissioner's priorities, and the Commission is already supporting Member States in tackling such diseases, which account for 80% of healthcare costs in the European Union. The numbers on diabetes were presented here, and these are not good and not getting better. And I'm not a medical doctor like my boss, who would like to go into detail, but still, isn't it partly the result from our unhealthy lifestyles, choice of nutrition, lack of physical activity, at least for the part of the diabetes 2? Perhaps the most worrying aspect is that already over 20% of school-aged children are overweight or obese, over 12 million in the European Union. These trends all point to an urgent need to invest in effective and targeted prevention. Yet encouraging people to adopt healthier lifestyles, including balanced nutrition and sufficient physical activity, is much more easily said than done. That's even on my example. But for example, how can parents refuse a chocolate or Snickers bar at a counter when two kids are next after 2-hour shopping? You just need to eliminate sweets from the counter. Initiatives such as European Parliament resolution on diabetes and the call on Member States to develop and implement national diabetes plan have our full support. And all of actions requested by European Parliament in that resolution are being implemented. The success also depends on the involvement of patients, families and organizations. The Commission supports Member States and stakeholders in addressing diabetes by tackling the common risk factors of chronic diseases, by supporting health systems in managing chronic diseases and supporting the direct action. In relation to risk factors, we should build on the comprehensive strategy for Europe on nutrition, overweight and obesity-related health issues. One way to do this is to make it easier to choose the healthy options, for instance, by reformulating certain foods. The EU framework for national initiatives on selected nutrients that is being developed aims to improve nutritional quality of foods. The Commission has already supported the Member States in implementing voluntary reductions of salt, and work is ongoing on saturated fat and on trans fatty acids. I should also mention another example of work related to diabetes, the Action Plan on Childhood Obesity, for which a monitoring plan has now been established. Discussions on the evidence base, on policy and on actions will continue within the high-level group on nutrition and physical activity. Furthermore, the best practice sharing will continue with the support of the health program, which I should mention is not very big. That's for future negotiations.
Definitely.
And in particular of the forthcoming joint action on nutrition and physical activity. We address diabetes as part of a comprehensive approach to chronic diseases. The first specific action on this work is a joint action for chronic diseases and healthy aging. This comparatively large project with a budget of 9.6 million involves 23 member states and helps them to move towards more efficient approaches in the prevention and management of chronic conditions. In addition to this joint action, the Commission is financing several research projects in the area of diabetes and is implementing a pilot project on prevention strategies for type 2 diabetes financed by the Parliament also. The main focus of this initiative is on school children and on how to prevent obesity and the subsequent development of type 2. The results of this project are expected mid-next year. Finally, there are other measures at Member State disposal that can have an effect on chronic diseases. For example, taxing highly processed, energy-dense foods could create an incentive for consumers to avoid them. Honourable members of Parliament, ladies and gentlemen, we are willing to play its part in addressing, our part in addressing the challenges provoked by chronic diseases. However, let us be clear, most issues in the area of health fall under responsibility of the Member States. The Commission is therefore counting on the active support of government and stakeholders. We also recognise and emphasise the important role of the European Parliament in playing its role in raising awareness and calling for action. And in this regard, the Diabetes Working Group of the Parliament plays an important role to encouraging Member States to act now in their own interest to tackle the challenge of chronic diseases, including diabetes. I look forward to hearing your opinions and suggestions, which I will pass naturally to the Commissioner, and thank you for your attention.
Thank you. Thank you so much. I think it was some very good things you said, especially the fact that all actions that we proposed in our resolution from a couple of years ago is already being implemented. So maybe the time is in for a new one, maybe, with new actions. Well, maybe. Mr. Vintunas, could I ask you a concrete question before I open up for the floor? What we have been discussing is that there could be a need for mapping out concrete actions in the area of diabetes and chronic diseases at a European level, so we have something to work towards. I mean, is it possible to say that in Europe, within 20 years, or 15 years, we would like to have reduced the number of people getting type 2 diabetes with, for instance, 10%, or that 25% of all people with diabetes, we should make sure that 25% less are getting food problems or whatever that is caused by diabetes. I mean, is it is it an option at all that we could try to make this kind of concrete actions at a European level, knowing, though, of course, that it is up to the member states to deliver, but having these aims to go for could maybe make it easier for member states to work in this area of diabetes and chronic diseases. Is that an option? Do you think that the Commissioner would be willing to work in that direction, mapping out some concrete actions?
I think Commissioner would be willing to work in the direction mapping out the concrete actions. What else we can do really to reduce the effect and the increasing number, actually to start to decrease the numbers. But the one thing what I would like to say, we would not want, and Commissioner would not want to promise something which he cannot deliver. If he makes a promise, he needs to be sure that he can deliver. So let's see what really we can work together, what actions we can put which could bring real results in life. We will have some concrete results next year, all the actions we are implementing. These will give us some ideas what steps are to be taken by the member states, maybe together with Commission and Parliament. And then we can make that list of actions, for example.
Well, I say thank you for that, because then we should sit down together. Yeah, that was encouraging, and I think that we should sit around a table to discuss it once we have the result of all these actions already in place, because I think we need to do something. And of course, all politicians know that it is dangerous to promise anything, especially if you think it can be difficult to achieve it. But anyway, I think that we need to be courageous and trying to say that, well, even though we might not get to the goal immediately, then I think we should have something to work towards in order to make sure that we at least try. Anyway, I promised you that we should have some time for discussion, and now I'm opening up for questions and comments from you, if you have any. We have around 12 minutes to discuss, so please feel free. If you want to have the floor, please introduce yourself so people know who you are. Yes, please.
Thank you. This is Şehnaz Karadeniz from IDF Europe, the chair-elect for the president-elect for the next term. Thank you to all the speakers. I just wanted to emphasize what Anne said, actually, because everything comes on implementation. If we don't implement things, the resolutions, the recommendations, and everything, all the declarations and so, then these are only very nice moments, activities, but if not implemented, as we see in our policy puzzle, I mean, ended a very nice presentation, a nice summary of the policy puzzle. We see that we know the treatments, we know what to do for prevention and so, but if it comes on the numbers, then the numbers are not promising for the future. Maybe we should discuss more how we can do the implementation, especially the cooperation, as you said, between the MEPs and national MPs, because if it comes on implementation, we need the nation MPs to get more involved and motivated. And then we need the NGOs in the countries to do something for it. I mean, so is there any... because this is the second time after a long time that I'm participating, so I don't know if there are any discussions going on about this. Thank you.
Yes, please.
Good morning. I'm Karim Bakouk from the European Commission, DG Research and Innovation. And I just want to answer about implementation. There is the Global Alliance for Chronic Diseases. And there are like 9 funders in the world, and the Commission is part of it. And the aim is exactly that, what works, in which circumstances, and how it can be scaled up. But implementation and research is a new field. It's not a rigorous field yet, and we are trying to develop implementation science overall. So we're working on that, and there was a call on type 2 diabetes, and the result would come in 2 years or 3 years.
It depends on research, but then we have other things, I mean, like not only the research, but...
Sorry,
it's implementation in real life. Yeah. But you have to understand why it works, why it doesn't work, and how you can scale it up. That's where the research comes. And after, of course, it has to be implemented in healthcare.
Thank you. And did you want to come in with a comment?
Well, briefly, I mean, you're absolutely right. Research is critical, but actually we have incontrovertible evidence in relation to the complications of diabetes, and it is the action in terms of clinical care and the engagement of people with diabetes in that management. We don't need to do any more research on that. It is actually doing it. And if I'm sounding aggressive, I don't mean to be aggressive. I'm just so really concerned, as all of us here are. So it really is critical. And I do again want to re-emphasize the position of the World Health Organization now in recognizing the importance of the management of diabetes. And I've made my own personal comments in relation to how I think there has been some distortion because of the emphasis on primary prevention.
There's no doubt that I think implementation of all the measures are important. Maybe it's one of the areas where EU could play a role. I mean, by benchmarking the member states, being even better to show what works and what doesn't. That could be, you know, that's yeah, we're already doing something, but we could maybe do even more. Yeah, please.
Well, we do. We are helping actually the willing ones, the 15 member states, to build the national plans on diabetes. So with the recommendations, with the guidelines which will come up next year, hopefully this will be finalized. That's our part.
Thanks. No, I have. I'm checking it. Yeah, please.
Hello.
No.
Sorry.
No, you first.
Okay.
You.
Me.
Yeah.
Olivier Arnaud from GDRF, Type 1 Patient Organization. What do you think that must be the involvement, the really contribution of in the puzzle of actors of the patient organization in the future? And is it more research? Is it more education, information? What is really your view about that situation globally?
Who are you asking concretely?
Sorry?
Do you ask all of us? Or
Yes, just generally your position globally about patient organization. You spoke about saying that patient is important, families, but how do you see really concretely the participation? Because there is a lot of puzzles here, and also some contributing in research funding, some contributing in education, and how to manage that with all the other research organizations.
Mr. Jonas, do you want to comment on that, or? Well, we could take a couple of speakers more, and yeah, you. Thanks.
Thank you. I'd like to thank all the speakers very much for their input and for the important points raised. But I would like to challenge both the Commission and the European Parliament represented here today to think differently about the concepts of prevention. I think we can very easily get distracted into thinking about prevention of type 2 diabetes in terms of the big picture, what one might call primordial prevention, the environment, the school, the shop. You mentioned the sweets at the counter. And I think it's very important to think about that. I think it's very important to build a better environment where it's easier to make healthy choices. And that there's a lot the Commission can do and the Parliament can do that, because that falls outside the public health domain. That is an area where the European Commission can propose and where the European Parliament can dispose. That it's an area where we can drive change. But I would challenge us also to think about prevention of secondary conditions, prevention of complications. And I'd like to remind us of the words of Commissioner Byrne when he was Health Commissioner, who said very succinctly, the real health ministers are the finance ministers. And until we can get people to understand the amount of working days lost as a result of diabetes, the amount of working days lost because people are losing their sight, have to have dialysis, have lost a foot, That's what is really hurting the European economy. And that's where the European Parliament has not only a right but a duty to speak up. So I would like us to think about prevention also in those aspects and realise that diabetes, as well as having a huge human and personal cost, has a huge impact on the European economy. Thank you.
Yes, please, Andy. Behind.
Thank you very much. My name is Stella Tsartsara. I am a gerontologist and as of this week also a promoter of the European Innovation Partnership for Active and Healthy Aging Action Group B3 Integrated Care. I would like to talk about three things. The first one is, I'm sure you know better than I do, it's awareness and prevention go together. There is no money, there is no time, and there are no resources to do separately. The second is that education should be pointed to middle administration staff members. Those are the ones that design, implementation, and carry on the political planning from one government to the other, especially in non-developed countries. And the third one, I like very much, Anne-Marie, your presentation about management. And indeed, how we are going to do that when funds are cutting from budgets. Well, news is, and I hope you all know this, that funds are going to continue cutting down, and there is no way that this can be returned. When the the World Economic Forum predicts 75% of GDP to address chronic condition and multiple morbidities. So there is no way that we go back. The APAHA, the B3 Action Group, suggests another model. Let's forget about health ministries managing integrated care from now on and move it to the regional level. There is no way the primary health care addressing and managing at least the first, the basic needs of management of diabetes and other chronic conditions, it's going to be out of hospital, and you know that. So socially developed models are the future, and this is where we are working. Who finances that? Who manages that? Of course, not the health ministries. Of course, not the employment ministries. It's going to be managed in regional level, and the finance, it will be from private equity and venture capital funds. I was in 10th of March at the AP the Commission, the European Commission, excellent summit. It was the future that was discussed there. And now the 3rd of June is going to be another extremely interesting summit on financing healthcare here in Brussels, also organized by the European Commission. And everything that was discussed there, that we are only using 10% of the available funding of private investment. So Karen Wilson from the OECD talked about social investment bonds. And guess what? When she asked that who is developing this off the room here back at the summit, there was nobody answering that. So we are developing one social impact bond in Greece together with the government of Biscay in Spain. And we are heading towards funding money from the private investors because there is no state money available for chronic condition management and education awareness and other programs. Another partner in this in the insurance.
Sorry, the time is running out. So
yeah, only two things I want to say. Another partner is the insurers and the active aging solution. The active living solution. So technology has to move in, and technology has to be part of the regional programming. Thank you.
Thank you so much. Well, the time is running out, so I will now ask the panel to give a couple of comments, and then I will give the floor to Teresa for some closing remarks. Anne, you first.
I just really to respond to who is going to manage that. This is obviously a nation-state, I beg your pardon, responsibility and the communities who engage with their politicians. I think it is possible to do it. We have to invest more. There is no doubt about it. And that is training and an adequate supply of competent professionals so to do. I won't make any other comments with regard to that in particular.
Thank you. And Mr. Vinchunas for the last remark.
Thank you. Actually, I will try to cover a little bit everything what was said. We have the things like education, prevention, management of the chronic diseases and all the parts in this process, and this cannot work separately. We have to address them together, but for that, well, we have to change a little bit thinking in the member states. The governments planned finances for 2-4 years upfront, and that's enough. To tackle the such problem like diabetes, you need to plan few political cycles ahead. How to change that thinking is really the answer. I mean, the health minister, finance minister, maybe, but we together, Commission, Parliament, stakeholders, have to demonstrate the real cost for the economy every day. Maybe that, and with that, implement really in the finance minister heads, in the government heads, and then this will start change.
Exactly. Chris Delicata?
Yes, I would like to reiterate what the IDF CEO stated. Yes, diabetes has a huge cost on society, and I think that the solution to all this is for member states to have adequate national diabetes plans. And I'm glad to note the Commission's commitment to help national member states who currently do not have a plan so that they could achieve this. A national plan should be seen as an investment. Yes, it involves a cost to implement and plan such a plan, but it definitely outweighs the cost of treating diabetes and complications. And a national plan and a strategy, a structured plan, would definitely reduce the hospital beds to treat complications of diabetes. So I think that the future lies with member states having structured plans in place to manage and treat diabetes in the medium to long term.
Thank you, Christelle. I'd like to thank every one of us, every one of you here today, especially for the input that you have provided us with and for your thoughts. I've been taking quite a few points, actually, from what you've been saying, but I'll just take 1 minute to comment on just a few of the ideas that have been raised. Initially, when I started, when I welcomed you here, I said that, these are not numbers, these are persons, and these are individuals who are facing challenges in their everyday life. And their challenges are not only in participating within society, but also in contributing towards that society. And that is where the cost concept comes in. Because if an individual cannot fully give his contribution or her contribution towards society, then that is going to be a cost on the government. And yes, I do agree that this is not a question just for the health minister, but also for the finance minister. But besides using this argument of cost and finance, I think we also should never forget that there are real people, real faces behind this disease. So it is not merely an issue of cost in the health sector, but it is also an issue of cost and an issue of addressing barriers and challenges in other sectors, in the education field, in the social field. Should we really identify, there was a question raised, should we really have research first, awareness then, followed by education? No, I would tend to agree with the Commissioner's representative here that research, awareness, education, management and prevention of the disease have to be simultaneously addressed. But maybe we do need some targeted measures, and targeted measures need to be based on specific data. So the data collection issue, once again, comes into play. The relationship between MEPs and MPs is very important, and in my case back home, we have actually established a group of MPs who are there to address diabetes and to come up with the national plan. And I can tell you this seems to be working pretty well. I would really like to thank the chef de cabinet of our commissioner to have attended here. But I would also like to thank you because you have clearly stated very encouraging words to us. And your words have been encouraging because it is clear now that the Commission is committed towards addressing diabetes, that the Commission is committed towards implementing the actions that have been identified in the 2012 resolution, but more so because you are also committed towards future actions, especially actions to map out concrete action. I do have one bit of a slight disappointment, which could possibly be turned into an opportunity, however. It is true that diabetes is a chronic disease, and it is true that we have to address all chronic diseases, but maybe it is also time to target diabetes specifically, not just as one of the many chronic diseases. And I think I'd stop at that. Thank you. There is some refreshments outside, so I do invite everyone to join us outside so we could really have some more informal discussion as well. And I'd like to thank Christelle as well for having chaired and moderated this meeting. Thank you, everyone.
Thank you.
Thank you.